Well, good morning, everybody. It's Congresswoman Lauren Underwood. I am so glad that you all have joined me for this workshop in partnership with the Centers for Medicare and Medicaid Services and the Senior Health Insurance Program. I am so happy that Greg McAllister and Sandy Leith are here to answer your questions on Medicare open enrollment, which lasts through December 7th. This is the time of year when you can join, switch, or drop a Medicare health plan or Medicare Advantage plan. And as long as your request is submitted by December 7th, your coverage will begin on January 1st, 2023. There have been some key improvements to the Medicare program because of the Inflation Reduction Act, which was signed into law. And I'd like to highlight a couple of those improvements before we answer your questions. The Inflation Reduction Act is historic legislation that will reduce healthcare and prescription drug costs, and it gives Medicare the authority to negotiate prescription drug prices for the first time. The Inflation Reduction Act also caps out-of-pocket drug costs as $2,000 per year for Medicare beneficiaries. It caps monthly insulin costs at $35 per month, and it requires drug manufacturers to pay a rebate to Medicare if they increase their prices faster than the rate of inflation. Some of these provisions take effect as early as next year, like the $35 per month cap on insulin costs and the rebate requirement, and other provisions will be implemented in a few years. These are crucial policies to lower costs for older adults and help those who need life-saving medication access the care that they need. If you have additional questions, please do not hesitate to visit my website at underwood.house.gov. Before we begin, I would like to remind our constituents, if you have any questions for a federal agency, my office is here to help. My office has experience cutting through the red tape with nearly every federal agency. Since joining Congress in 2019, I have helped constituents recover over $22 million. That's money from earned benefits that were returned following inquiries to my office on everything from veterans benefits to Social Security payments to tax returns. I've never forgotten that my office is your office. We're here to work for you and to be a resource, so you can call us anytime. Our number is 630-549-2190. Now, during this Facebook Live, our experts are here to answer questions on enrollment. Moderating today's question and answers will be Asad Ghani. Asad is a member of our Healthcare Advisory Council, and he has experience working with Medicare. Hi, Asad. Thank you for joining us today.
Good morning, Congresswoman. Good to see you.
Thank you. Also joining us is Greg McAllister from the Centers for Medicare and Medicaid Services and Sandy Leith from the Senior Health Insurance Program. Greg and Sandy, thank you for being with us today.
Thank you, Congresswoman.
Pleasure.
Oh, good. Okay, thanks. So now let's learn about open enrollment. Over to you, Asad.
Thank you, Congresswoman, and thank you, Greg McAllister and Sandy Leith, for being here to discuss Medicare annual open enrollment. I'm very excited to be here to discuss this topic. As the Congresswoman said, I'm Asad Ghani. I'm on the Congresswoman's Healthcare Advisory Council, and we're here this morning to discuss this very, very important topic. We're going to hand it over to our presenters, and then we're going to have some questions and answers following their presentations. First, I'll turn it over to Greg from the Centers of Medicare and Medicaid Services.
Thank you, Asad. And are there slides?
There we go.
Okay. Thank you. I think Congresswoman Underwood said a lot of the most important information that I was going to present. First of all, let me just say that this information is correct at the time of presentation, but it's subject to change as all federal programs are. You can go to the next slide, please. As the Congresswoman said, Medicare open enrollment is the same time frame every year. It runs from October 15th through December 7th. And it is the opportunity each year that you can make changes to your health insurance coverage. You can join a Medicare Advantage plan or standalone Part D plan or a Medicare Advantage plan with Part D, or you can change your plan, or you can return to original Medicare. And it is the time each year we like you to review your current coverage to make sure that it continues to meet your needs. Next slide. So this is what you can do during the open enrollment. You can join a new Medicare Advantage plan that is either a different plan from the one you're already in, or from original Medicare to Medicare Advantage. You can do the same thing with your Part D coverage, join a new one, or enroll for the first time. Switch from original Medicare to Medicare Advantage, switch from Medicare Advantage to original Medicare, with or without a standalone Part D plan. And when any changes you make during the open enrollment period become effective January 1st, 2023. Next. There are a few things that you should be sure to make sure you check before selecting a plan. Make sure that the plan you are thinking about joining has access to your preferred healthcare providers, your hospitals, and your doctors. That you have access to the preferred pharmacies that you want to use, the ones that are close to you or the one that you are most comfortable using. That it gives you access to the needed benefits and services, and also check your costs, including premiums, deductibles, and cost sharing. If Medicare has a plan finder feature that you can use, and it'll help estimate some of those costs for you. And you can take a look at the quality of the customer service that the plan has. Each year, every household with a person with Medicare gets the Medicare and You handbook. You should have yours already if you have Medicare. And it is a really good summary of the Medicare program and includes changes to the Medicare Part B premium, which is going down $5.20 for 2023. And it's a really good primer on the Medicare program and how it operates. Very important for people with Medicare Advantage plans or Part D plans. Each year by October 1st, your plan should send you their annual notice of change. And this is a very important document. It tells the changes that your plan has for the upcoming year, including any costs like premiums, deductibles, cost sharing, any changes to benefits and coverage rules, any changes to the drug formulary and the networks, including preferred pharmacies. This is very important. This is what will let you know if you need to change your plan. If you do nothing to your Medicare Advantage or your Part D plan, you are re-enrolled in your same plan generally. Next. And these are things you should take into consideration when thinking about a Medicare Advantage plan: the monthly premium, the out-of-pocket expenses, including cost sharing, coinsurance, and deductibles, the plan's maximum out-of-pocket amount. People in Medicare Advantage plans do have a maximum out-of-pocket amount. The highest out-of-pocket amount for 2023 is around $7,500. So that means that you can spend no more than that in a plan year for in-network services. Make sure that you're in the plan service area. Make sure that your doctors and hospitals that you like to use are in the network. See what the coverage rules are for accessing services. Do you need prior authorization to see a specialist or to get a diagnostic test? Coverage rules regarding access to drugs and other services to make sure that the drugs that you use, especially if you use a brand name drug. See what additional benefits the Medicare Advantage plan has. Many plans do offer additional benefits such as fitness programs or dental or vision services. You can see what the star rating of your plan is. That is just a very basic summary to let you know how your plan performs in various measures. And what other coverage you may have is a very important consideration. If you have retiree coverage that works well, or if you're still working and have employer coverage, a Medicare Advantage plan might not be right for you. Oftentimes, if you have retiree coverage and you have to give it up to join a Medicare Advantage plan, you could lose that retiree health coverage forever. And also, some retiree plans, some employers offer Medicare Advantage plans themselves. So in order to access your retirement coverage, you have to join the employer's Medicare Advantage plan. And if you choose another plan, again, then you are getting rid of your retirement benefits. Next slide, please. Part D considerations, medications taken that you take. All drug plans have to cover a wide variety of classifications of drugs, but there are specific drugs in every classification, and not every Part D plan covers every drug. So make sure that the specific drugs that you take are on your plan's formulary. See if you need prior authorization to access your drugs. Step therapy. Step therapy is where that you must try cheaper, usually a generic version of a drug, before you can get access to a more expensive drug, usually a brand name drug, and what the quality limits are. Of course, you'll want to check your monthly premium and the annual deductible for your plan, other cost sharing. Make sure that the pharmacies that you want to use are in your network, or you may want to use mail order, and what other drug coverage you have. Generally, if you have other drug coverage that is creditable, that means it's as good as an average Part D plan. You may not need Part D coverage in addition to that. Next slide. As Congresswoman Underwood mentioned, there are a lot of changes to the Part D program specifically, and also to Medicare in general for the Inflation Reduction Act. And starting in 2023, if you have Medicare Part D and take insulin, which is about 3 million people, you will pay no more than $35 copay for a 1-month supply of your covered insulin product. So you'll want to make sure that the specific insulin product that you take is on your plan's formulary, and if it is, you will not pay more than $35 a month for that. And that change is effective January 1st, 2023. And your insulin will not apply to your deductible. And you are encouraged to get help if you have insulin using Medicare Plan Finder, maybe with a ship, as Sandy will talk about later. Next slide. Next slide, please. And as I mentioned, star ratings are just a general rating to give you an idea of how well your plan performs. It should not be the only measure you use when selecting a plan. It is probably more important to make sure that your preferred providers and hospitals and doctors are in the network. But the star ratings range from 1 to 5 stars. So it's something to take into consideration. Next slide, please. Medicare Plan Finder. That is the tool that CMS makes available to people with Medicare. It's easily accessible on medicare.gov. And you can access it either anonymously using just your zip code and some other general information, or you can sign in to your medicare.gov account and get a personalized search. The medicare.gov account will allow you to it automatically enters all of the prescription drugs you've taken in the last 12 months to make it easier to compare your prescriptions. And you'll get better information than if you just do a basic anonymous search using your like your zip code to make sure that you get plans in your area. Next slide. If you do use Medicare Plan Finder and use insulin, please be aware that the insulin drug pricing was not made available when the prices were loaded into Medicare Plan Finder. The legislation is from August, and that was after this information was already loaded. So we do ask that you take that into consideration. There is messaging on Medicare Plan Finder about the $35 insulin. So the cost on Plan Finder for insulin will look higher than the $35 a month, but just be aware, and then you can take that into consideration. Next slide. And that's just what the Medicare Plan Finder homepage looks like. So you'll know you're at the right place. It's at medicare.gov and select a plan. Next slide. This is very important. Beware of marketing fraud, and beware of there's fraud, and then there's people who just do not have your best interest at heart. So watch out for people who pressure you to join their plan. People who are trying to sell you a plan are not trying to sell you necessarily the best plan that's available to you for you. It's the plan that they sell that's available to you. So make sure, and that doesn't mean that an agent can't do a good job, but just make sure avoid high pressure sales. If people say they represent Medicare or give you something for free, that's not permitted. They do not represent Medicare. They represent themselves or the organizations they work for. Or people trying to market Medicare Advantage plans cannot call your home without permission unless you are currently enrolled in their plan. They cannot say that you'll lose your Medicare benefits if you don't sign up for their plan. And they cannot require you to provide contact information at a plan event. If you do provide contact information at a plan event, they are then allowed to contact you. And also beware of the marketing you see on television, people who offer many great benefits. If it sounds too good to be true, it often is. Many of the benefits that they tout on those commercials may be available somewhere, but probably not in your service area. So I think that concludes my portion of the presentation.
Thank you, Greg, for providing all that great information. Next, we're going to have Sandy Leith from the Senior Health Insurance Program. Sandy, you're on mute.
Thank you. I double muted myself. Pleasure to be here. Good morning, everyone. I have slides coming right up. I'm from the Senior Health Insurance Program, and that's SHIP. And we do counseling throughout the state. We have 1,000 counselors at 300 different what you would call not-for-profit sites. They're there to help you be a better consumer and to help you through the maze of Medicare, which can be difficult. I've been working with Medicare now for 30 years, and I learn something new every day. Almost, I swear, every day. So it is something you need to be engaged in. My contact information is listed there. aging.ship@illinois.gov will allow you to ask us a question all day long during regular business hours. I have a team of elite trainers that have been working with Medicare also for years of experience, and we will help you. So let's go to the next slide and we'll get started on the Senior Health Insurance Program, or SHIP. We've been around since 1988, and we're at the Illinois Department on Aging. We have offices in Springfield and some in Chicago. So we do cover the state with our 800 line at the Illinois Department on Aging. Next slide. Eligibility to Medicare. I'd like to just back up a tish and just talk about eligibility in case you're someone who is new coming onto Medicare. People who are 65 and older become eligible for Medicare, but also we have a lot of people that are under age 65 on Medicare due to a disability, and that's Social Security disability. So you're deemed disabled by the Social Security Administration, and you have a 24-month wait. If you are end-stage renal disease or ESRD or ALS, Lou Gehrig's disease, you're fast-tracked into Medicare for this national health care that you can take advantage of. You must be a U.S. citizen or legal resident, and you have 5 years of continuous service in order to become Medicare eligible. Next slide. There we go. Automatic enrollment. This is something I like to always talk about, because if you are taking cash benefits from Social Security now and you're age eligible for Medicare or disabled, then you're in the automatic track where you will automatically receive this red, white, and blue card that you see here, along with a packet that looks like the bottom figure. It's a 5x7 packet, Welcome to Medicare. Your Medicare card comes loaded with Medicare Part A and B, and your number will be there. Very secret number. Keep that safe. But I always like to tell people the only ones that are going to get this are people getting automatic enrollment, would be people getting Social Security monthly benefits. So if you're moving along, you're age 70 and you're still working, you do need to check in with Social Security and trigger your Medicare benefits, because they will not go reach out to you. Very important thing. Or call SHIP and we will walk you through the process as well. Next slide. And this is just the parts of Medicare A, B, C, and D. That's our, actually I got A, B, D, and C, because we talk about how A and B are hospital and medical insurance. D is your drug insurance. So that would be one way to receive Medicare, just through traditional A and B of Medicare with the drug insurance wrapping around that. Or you can take it all through a private entity. This is privatized Medicare called Medicare Advantage. And there are many, many of those products out in the state of Illinois. For instance, I did one zip code in Joliet, and it had 69 different Part C plans available. Next slide. And then the next two slides will be just the original deductibles and co-payments for the year 2023. So for instance, Part A is hospital insurance. That is when you are in a hospital or a skilled nursing facility. For the most part, that is what Part A pays. That's what you get usually by paying in your taxes, and that's a free benefit. So you get this monthly benefit, and the deductible for becoming an inpatient in a hospital is $1,600. That's $1,600 in 2023. Next slide for Part B would show you a chart. And this is a lot of information on these charts, but I just wanted to keep these in here for you to have a reference. But Part B is your medical insurance, everything outpatient, your outpatient services at a hospital, home health care, medical expenses, wheelchairs, your ambulance, your lab work, everything. And you pay a premium for this monthly. So if you have used Part B services, they start January 1 on a calendar year, and you have a $226 deductible. And for the most part, it's an 80% Medicare, 20% you pay. A lot of people get a supplement plan or other insurance through retirement to help wrap around Medicare and pay the parts that Medicare leaves behind for you to pay. Next slide. And the Medigap I mentioned. So a lot of people like to, if you're taking traditional Medicare, you wrap around a Medicare supplement or Medigap. Those terms are interchangeable. And you have a option once you turn 65, go on to Medicare Part B, or at any age, when you first go on to Medicare Part B, as in the medical insurance, you have 6 months that nobody can turn you down for a policy, a Medigap policy. So your first 6 months, whether you're under age 65 or over age 65, you have an open enrollment to Medigap. That is the law, and we will help you with that at SHIP as well. Next slide. And if you do not want to take traditional Medicare, you can always go through Medicare Part C or Medicare Advantage. And we have a few slides that will explain the kind of the differences of that. If you go to the next slide. And this is a chart. There's about 3 or 4 pages of this chart. It's another way to get your Medicare, but the delivery of the services and the cost share structure is totally different from the 2 charts that I showed you with A and B of Medicare. So it's important to know the differences before you sign up. When someone is selling you a Medicare Advantage plan, it is not a supplement to anything. It is your Medicare. It is replacing your Medicare with a private entity. And these can be very low cost in monthly premiums, and you cannot be turned down for these products. They must accept everyone. You can often get dental, vision, and hearing and fitness programs thrown in with the deal, and that's what the Medicare Advantage companies will do, and they will explain that to you. And you've probably seen commercials on TV about these benefits. But there are a lot of things you need to know about the fine print when you're going into a Medicare Advantage plan. It can be a great experience, but you've got to know what you're doing. So next slide. And we'll have another part of the chart that says original Medicare versus Medicare Advantage. Original Medicare will pay, the Part B services, anything that you need, Part A services. A lot of times you get a Medigap to wrap around it, but on the Medicare Advantage on the right side, out of pocket does vary. You pay the monthly Part B premium still though. So don't think that you don't have to have Part B when you do have Medicare Advantage, because you still pay the Part B premium when you're in here, and any other premium that the plan should charge you. And you don't need, and you should not have a Medigap policy when you are doing Medicare Advantage, because you're not in traditional Medicare. Medigap only works with traditional Medicare plans. And we find a lot of people hanging on to their Medigap policy and having a Medicare Advantage plan, which should not happen. That is something that is a waste of money and it's unusable. Next slide. Original Medicare versus Medicare Advantage. Again, the coverage. Original Medicare, you pretty much can go throughout the country, doctors, hospitals, and get services. You cannot go out of the country with Medicare, but you do have services just about anywhere. You would have to get a drug plan. So that's a separate part of Medicare that you need. And in most places, you can get supplies covered, wheelchairs and durable equipment. Medicare Advantage, on the other hand, must cover these same services, but they offer extra benefits, as I mentioned. And the drugs are included in most of the plans. So you would have to make sure you do have a Medicare Advantage with drug coverage. There are a few that do not have drug coverage out there. And in many cases, services and supplies, you'll probably need to check in with your primary care physician, but that would be covered as well. Next slide. I think that's our last one on Medicare Advantage. So traditional Medicare, when you're traveling, again, does not cover you when you're out of the United States. You would check with your Medigap policy because a lot of times there's some foreign travel. Medicare Advantage plans do not cover outside of the United States, but they could add that as a supplemental benefit. And I do see a lot of plans adding that as a supplemental benefit as well. Next slide. And then we have just a slide about Part D, which is your drug coverage. And Greg went over a lot of the ins and outs of that. But we have the standalone drug plans or one that is tagged on to Medicare Advantage. So there's two different ways to get Part D, as in drugs. Next slide. And we do know about the open enrollment period. It is here. It is October 7th or October 15th through December 7th. Your coverage would begin January 1. And that's what SHIP is here to help you. We will help sit down with you one-on-one or talk over the phone if you prefer. And SHIP counselors help you with these drug comparisons, the Medicare Advantage comparisons, and we can even price Medigap policies for you. We have a pricing tool made available through a federal grant, and we can give you actual right on the day pricing for your Medicare Medigap policies or your Medicare supplements. So we pretty much handle it all. Some of them are volunteer counselors, and a lot of them work through our not-for-profit agencies. Next slide, please. Very busy time of year for us. We do talk about this, Greg did too, the Medicare Advantage or Medicare.gov personalized plan finder experience. And you can make an account yourself and actually pull up all of your drug list and be able to see your current coverage, or counselors will help you with that as well. It is so much easier when we have a personalized account, and we can check that for this year and next year, see what your drug list, if it's changed, if you have any other needs, and then we can enroll you. So SHIP can do it all with this in-person search, or you can try that and we will coach you through it as well. Next slide. And our contact information is here. Please let us know if we can help you. aging.ship@illinois.gov or 1-800-252-8966. Thank you.
Thank you, Sandy. I know that is a lot of great information that will be very much appreciated by everyone watching. Now we're going to go to the question and answer portion of this workshop. The Congresswoman's office has received a number of questions about Medicare open enrollment. The first one is for Sandy. Sarah asks, is there a supplemental dental insurance I can buy? Is it worth it?
We get a lot of dental questions, And I think a lot of people see that on TV with the Medicare Advantage plans talking about how they can offer dental coverage. So you would check, if you have Medicare Part C or Medicare Advantage, you would check with that company to see what your dental benefits are. Is it routine cleanings? Is it true dental work? Also, if you have traditional Medicare and Medicare supplement plans, some of the Medicare supplement plans are starting to offer supplemental riders, some supplemental packages you can actually purchase. So that's another way to buy supplemental dental insurance. And you could check with a broker to see if there is any other insurance out there for just dental. But for the most part, I always direct people to their current coverage and see what you've got out there.
Great. Question for Greg. Anna asks, what are the different parts of Medicare and how does a person determine which parts to enroll in? You're on mute. Yep. There you go.
Thank you. I'll go over the basic parts of Medicare. Medicare Part A is your hospitalization insurance. It starts when you are admitted as a hospital inpatient. And if you qualify, it could also cover your skilled nursing home coverage. Part A is free for most people. You get that through your work history of either yourself or your spouse. If you have 10 years of work history or 40 quarters, you get Part A for free. So it's generally worth it to take Part A if you're eligible for it. Part B is your supplemental insurance, or it's basically your physician services, your diagnostic testing, your hospital outpatient services, lab test, durable medical equipment. That is covered under Part B. It is optional coverage, and it has a premium. This year, the premium is $170.10. Next year, it's going down $5.20, so $164.90 or something like that, $65.90. And it's optional coverage, but we do recommend, most people generally have it, have a need for it, and that is coverage that pays 80% of Medicare's allowed amount. You may have retiree coverage that will pay if you don't have Part B, but most retiree coverage, even if you have it, it'll only pay if you also have Part B. So that's Part A and B. Part C is the Medicare Advantage plan that Sandy talked about so well, and you need to have both Part A and Part B, so you have to pay your Part B premium in order to be in a Medicare Advantage plan. And then Part D is your prescription drug coverage if you need it.
Great, thank you.
Also optional.
Thank you, Greg. Question for Sandy. Anne asks, what are the disadvantages of a Medicare Advantage plan?
When I do get calls about complaints, people are not happy with their Medicare Advantage plan, it's usually because they're in a regimen of an illness. They're in what we call a spell of illness in Medicare world, and they're not happy with the fact that they have to use referrals, especially if it's an HMO. They rule. The Medicare Advantage plan will tell you the network that they have made contracts with, and that's where you will go for services. So when you have a Medicare Advantage plan, you just cannot jump to Mayo Clinic or anywhere outside of your network without having a referral process. There's also co-payments. Medicare Advantage can be very low premium or no premium, and that looks wonderful. But once you start using the services, that's where the co-payments come in. So every time you have a co-payment, or every time you have a service, you have a co-payment. If you're in a regimen of chemotherapy, you may have a co-payment every day for so many weeks. And people call us when that happens, and they clearly state, I would like to get out now. Well, a lot of times you cannot. You have certain enrollment times to get in and get out, and we have to coach people through that. So then what they would do is appeal and use their voice to ask for the services that they feel they should have, talk to the plan. There are external appeals processes, and we do work through that. It is cumbersome, but that's, for the most part, I think the best answer to that question is, what have I had complaints about? And it is the out-of-pocket and the network. It's choice and cost. And as Greg mentioned, there's a $7,500 annual cap, but that again is quite a bit of money in co-payments to reach before you know you're kind of home free for the year. Many plans will have, though, a $3,000 cap or a lower cap, a $4,000 cap. So you would check with each and every plan. As I mentioned, one zip code I checked had 69 plans. So it's all over the board. You have to really do a lot of homework before you know exactly what you're getting into.
Yeah, I just add, I would say prior authorization requests and limited network access are probably two of the biggest. Yeah. With the original Medicare, you don't have You don't have network restrictions at all, and there's very little prior authorization. So those are two things to consider.
Great, thank you. This is another question. Mary asks, what are her best options as a retired educator? This one's for Sandy.
As a retired educator, when you have retirement insurance like that, sounds like a municipality or retiree insurance is usually available to our educators. And you would definitely need to check with your human resources and your insurance carrier presently. So if you're getting ready to retire, check that out, see what your options are, and understand Medicare. The best thing you could do is get a hold of the Medicare and You. Oh, I happen to have one here. Carry it with me all over. Medicare and You 2023. It's the best read you're going to find on Medicare. It's quite a thick book, but that is one way to get educated, know what's out there. And yeah, Greg, you have one too. Okay, fine.
My camera's not showing it. It's a good resource.
But I know what you're holding up. But there's so many questions. Do I take Part B when I'm, when I have that I'm on that cliff and I'm getting ready to retire, and what do I need to do? Well, I'll just stay on the plan, or I won't. Make sure you check this with Social Security, with a SHIP counselor, with anyone and everyone you can, because we want to make the right decisions now before you jump off that cliff and have penalties for late enrollment later because you were retired and you did not have an excuse not to take Part B. So a lot of that question is so loaded. We could go on for days, but please check in when you're dealing with that decision of what am I going to do? When am I going to retire? Best time to talk to us. It could be 5 years down the road, but talk to us at SHIP about that.
Right. Greg, a quick constituent asked, what is the best option for those who need hearing aids?
For Medicare Advantage is the best option. That would be an extra benefit that many Medicare Advantage plans do offer. Original Medicare is excluded by law from offering hearing aid coverage. It's really interesting to see what happens. The FDA just recently approved over-the-counter sale of hearing aids, so it'll be interesting to see if the price of some of those comes down a bit. So that would be another option. Is buying a hearing aid over the counter.
Yeah. Greg, a constituent was wondering what the Medicare Extra Help program is and how to sign up.
Medicare Extra Help is assistance with your Medicare Part D prescription drug costs. It is a program to people with limited income and resources that is available through the Social Security Administration. You apply for the program through SSA, and you do have to meet income and resource limitations. And if you are eligible, it'll help pay your towards your premiums and your co-payments for your drugs. It'll greatly reduce your out-of-pocket cost for your drug prescriptions. Sandy, do you have anything to add to that?
No, you covered it. Our SHIP counselors help you with your extra help application. It's on socialsecurity.gov.
Yes.
Easy app. And boy, it doesn't take that long, and that could save your life.
It's a great program.
Yeah, the wraparound benefits and the help with your premiums, it's wonderful.
Great. This one's for Sandy. A constituent reports, I have been told that Medicare will not cover the medication I need. If I change my plan to something that will cover the medication, will I have to change providers?
So it depends on what you start with. So we're needing a drug that you can't get, it sounds like. And are you in a Medicare Advantage plan to start with? Then if you can change plans, which a lot of times you cannot, then yes, you may have to change providers. But the first thing you do is stop and try to appeal. And if there is a medical reason why you can't take any other drug, then your doctor will help you with that and submit evidence. And those appeals go to outside appeal groups. You start with the plan first, but appeal, and it will go to an outside peer review, and just keep at it. If it is indeed a drug that you cannot get, then we talk about other manufacturer assistance programs out there, and SHIP counselors, and Medicare.gov actually has a link to other pharmaceutical assistance programs that may be able to help you as well.
Greg, a constituent was wondering whether they can obtain a supplemental plan without joining Medicare Advantage. Would you please provide information on this?
Sure. Thank you. A supplemental plan, that is Using technical jargon that we use, a supplemental plan means Medigap. So Medigap is supplemental coverage. And as Sandy mentioned, you cannot have a Medigap plan and a Medicare Advantage plan. It's one or the other. If you have a Medigap plan and you want to try Medicare Advantage to see how that works for you, the first time you enroll in a Medicare Advantage plan, you have a 12-month trial period to see how you like it. And if you don't like it, you can drop out of that Medicare Advantage plan and re-enroll in your Medigap plan. So that is basically what supplemental coverage is. And it's a Medigap plan, and you cannot have it with Medicare Advantage.
Thank you.
Yeah, and to add to that just a second, I out in the public when I'm doing presentations, that's the first thing they ask, what can I buy to supplement my Medicare Advantage plan? And the answer is you cannot buy anything to supplement your Medicare Advantage plan. So let's get that out there. So everyone will stop asking that. Don't ask your neighbor, don't ask your friends, ask an expert. And we've got it right here recorded, right? Right, Assad?
Yep.
It's on the record.
This is on record. You can always go back here for more information.
Yes.
Greg, do constituents need to be enrolled in Medicare Part B to sign up for a Medicare Advantage plan?
Yes, they do. Medicare Advantage plan is a combination of your Part A and Part B benefits, so you must have both. You must continue to pay your Part B premium in order to be in a Medicare Advantage plan.
Thank you. Last question for Sandy. A constituent writes that they cannot afford their medication even with Medicare and their supplement. Is there anything that they can do to help reduce cost?
CHIP deals with a lot of that, where you may have Medicare, you may have a Medicare supplement, you may have a Medicare Advantage plan, but you still can't cut it with some of the co-payments. I mean, these things can be 40% of the drug, even with insurance for your drugs. But extra help that we mentioned through Social Security is a wonderful way to supplement. And if you are above income and you think, well, extra help turned me down, but boy, bills are stacking up, co-payments are racking up, I need help, I've got all these bills, maybe, just maybe, we need to go into a Medicaid application and put you on, in Illinois, and this is an Illinois thing, we have a spend down. What we do is prove that you have maybe you're $300 over Medicare or Medicaid's guidelines for assistance, but we can prove that you have more than $300 in medical bills, spend those down, and apply for a medical card. If you get a medical card in the state of Illinois for 1 month, you're going to get extra help for the rest of the year. And if it's early in the year, that's wonderful because you're going to have your premiums paid for your Part D and your copay subsidized. If it's later in the year, you may get it for the whole next year as well. So we call that the back door into Medicare extra help. And CHIP counselors have to know the Medicaid rules as well, which are absolutely just another way to add another layer of confusion. But they fight through that. They do a great job and will help you with spend down if you feel that you're low enough income or if you are really struggling. We need to just take a look and see what else we can do. There are other programs through the Illinois Department on Aging that may bring people into your home. We may be able to get you a care worker. Did you know if you do get a care worker through our community care program, you can get your medications a lot of times. That will get you to the Medicaid levels, and then your medications are zero copays. So there are many programs that trigger extra help for your drugs. All you got to do is ask.
Well, thank you. That was a lot of great detailed information that I know those questions are all over our district and all over the country, really. Thank you so much. This concludes our event. Thank you for joining us today. And thank you, Greg and Sandy, for all that great information. A couple of notes. If you have any follow-up questions for the Centers of Medicare and Medicaid Services, you can find more information at www.cms.gov or by calling 1-800-MEDICARE. If you have a question for the Senior Health Insurance Program, Sandy, their number is 800-252-8966. And finally, if you have any questions for Representative Underwood's office, they're very open door office. Please do not hesitate to contact her office at underwood.house.gov or call 630-549-2190. thank you for joining us and have a great, great day.
Thank you.